COVID-19 antibody drugs from Regeneron and Eli Lilly should no longer be used because they don't work against the Omicron variant of COVID, according to U.S. health experts. That now accounts for nearly all U.S. COVID infections, and the FDA is revoking authorization for use of both drugs. As a result, the monoclonal antibody treatment centers here in Northeast Florida and statewide have been closed. Joining me on the morning show is Dr. Mo Reza, an infectious disease specialist at Mayo Clinic. Good morning.
Good morning. I'm actually an infectious disease doctor at Kent Community Health Hospital setting.
So this move was not unexpected because the drug makers said the infusion drugs are less able to target Omicron because of its mutations.
Exactly. So this is, to me, is not new news. The data from the laboratory studies have shown that the effectiveness just goes down pretty dramatically. And this is coming from the companies themselves, which are a for-profit company.
So no surprise, this has become a political hot potato. Governor DeSantis is blasting what he calls the Biden administration's reckless and sudden decision. He said, quote, "Without a shred of clinical data to support this action, Biden has forced trained medical professionals to choose between treating their patients or breaking the law. It will cost some Americans their lives." So is there clinical data, or is this just a political grenade?
Yeah, so I'm a clinician, and I can talk to you about the clinical aspect of it and the signs that we're seeing. And what we're seeing now, as you mentioned, 99% of new infections are due to Omicron across our country. And these two monoclonal antibodies are not effective in doing what they need to do to minimize the risk of severe disease. And this is in laboratory studies. We don't have clinical data yet, but that can take months to come out. A good example is when Omicron was first diagnosed in South Africa. Initially, it took us weeks to get that laboratory data about how effective our vaccines were. That's kind of same thing we do with this medication as well. A lot quicker data comes available through the laboratory studies, and then we have to look for clinical data as time goes on, but that may take months. And in the meantime, we in medicine want to do no harm. So if we're seeing that it's not working in a laboratory setting, giving it to people may not be effective. So clinical data should follow, but at this point, it doesn't look like it's effective against this variant.
There are alternate therapies available to battle early COVID-19 cases. And didn't the FDA just ramp up the use of remdesivir to treat more patients?
They did. So those are other fantastic options that are available. They're available in limited supply. So sorturimab, which is a monoclonal antibody, that does work to decrease your risk of hospitalization and death by 85%. Remdesivir, which is another medication antiviral, that can be used in the outpatient setting to decrease your risk of hospitalizations. And there are other oral medication, Paxlovid and another medication by Merck, that have also shown to reduce your risk of hospitalization and death. But granted, these are in limited supply at this point, but these are other fantastic options that are coming available and are available at this point.
And given this news, once again, medical experts are repeating that none of what's going on is a substitute for vaccinations.
Exactly. More and more, we tell our patients, I tell my patients, the vaccines work to prevent severe infection. It's not going to give you 100% protection against COVID, but what it does do is decrease your risk of hospitalization and severe infection, along with using that layered approach, wearing a well-fitted mask, multi-layered over your nose and mouth, and avoiding those risky interactions where you're indoors with lots of people that are not wearing masks. So those are all steps we can take.
And starting this Friday, those N95 and KN95 masks will be available at a lot of outlets, including Winn-Dixie, Harvey's, Walgreens, and even CVS and other places. Dr. Reza, thank you very much for your time. Appreciate it.